Community Connect is Bexley's social prescribing service, which aims to connect people to activities, support and services in the local community that can improve their wellbeing. There are lots of issues that can affect a person's health, such as isolation and loneliness, finances, stress and lack of exercise. Community Connect aims to empower patients to access services that can improve their overall health and wellbeing.
Bexley has a strong community and voluntary sector that's able to support and empower patients to improve their health and wellbeing. The CCG and the local authority jointly fund Community Connect in Bexley, and for the CCG this is our way of giving GPs in primary care a direct link to the voluntary sector to provide holistic, non-medical support for their patients that isn't available on the NHS.
Community Connect encapsulates the critical role of the voluntary sector in keeping people well and preventing people from entering into a crisis. Community Connect is also providing insight on the emerging needs of our communities and helping the voluntary sector, the council and the NHS work together to meet the needs of local people.
As a GP, a lot of patients come to me for non-medical problems that can impact on their health and well-being. There are so many services in the community which could support them with those problems, but it's hard to know what's out there and how to access it. Referring patients to Community Connect means that I am able to do one quick referral to help them to access support for those needs, as well as their medical ones. It's a simple process, and the feedback that we've had so far from patients has been positive.
The easiest way to refer is to complete the referral form on DXS or an online referral. Once we receive a referral, we'll contact the patient within 7 days. We also have volunteers that are able to talk to patients within the surgery and take referrals if there are any areas that they would like support with. Sometimes people have issues which they think are more minor, so they wouldn't bother their GP, but they will talk to a volunteer.
As a wellbeing coordinator, once we receive a referral, my role is to meet with patients and have a conversation about their overall wellbeing and what is important to them. We talk through different areas of their life, any needs that they have and what they would like to achieve. We work closely with them to identify what would be the best option for them and then make referrals on their behalf, as well as leaving them information about other things that they may be able to access.
There are so many great organisations in Bexley which offer a wide variety of things that can help people, such as support groups, social clubs, money advice and volunteering.
I met with Chelsea because after I retired I had more time on my hands. Chelsea told me about different groups at the library and referred me to a lunch club where I made new friends. Now I'm also a befriender, so I visit other older people who aren't able to get out as much.
We basically discussed what would be the best next step for me, how many years I've been suffering with anxiety, and we were discussing about what I get up to during the day, so I do quite a lot of walking and stuff. So we were looking at walking groups to begin with. We got to reinstate, I think, and we went from there really. They've been great and Chelsea's been there for me. She was calling me a lot of the times when I started reinstate, making sure everything was okay and checking in with me. You know, they were great.